Welcome and thank you for joining. My name is Trixie Thibodeau, Health Educator for Community Health at Atlantic Health System. Today's webinar, Adverse Childhood Experiences, and being presented by Ashley Lusick. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions, and for comments, use the chat. We will try to get through all the questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. The program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call us at 1-844-472-8499, option 3. Now I'm going to turn it over to Ashley. Thank you so much, Ashley, for the presentation today.
All right, everyone. Welcome. And again, thank you for joining today for today's presentation of adverse childhood experiences, which throughout the presentation you will also hear referred to as ACEs. As Trixie mentioned, my name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. So again, this content today is being presented by a health educator. This presentation is intended to provide basic knowledge to help increase awareness of available resources. A health educator is not able to answer questions related to clinical diagnosis, follow-up, or treatment. By the end of today's presentation, it is my hope that you will all be able to identify the study that sparked the need for a public health concern regarding adverse childhood experiences, to be able to list at least 2 examples of ACEs, and lastly, to be able to list at least 2 strategies that the CDC recommends for reducing adverse childhood experiences. So childhood is made up of experiences, both good and bad, that shape who you will become as an adult. From the time we are born, we are being shaped as a person. The love and connection we feel with our families helps us to become healthy, well-adjusted adults. When we are connected to our caregivers, we have a bond and a strong sense of self. If we do not have that connection or experience adverse childhood experiences, we may experience challenges that impact us throughout our life. Like the good childhood experiences, the negative ones can also impact us. There's always been an acknowledged connection between trauma and healthy development. However, the landmark ACEs study by the Centers for Disease Control and Prevention and Kaiser Permanente deepened this understanding, noting the first connection. This study was conducted from 1995 to 1997 with 2 waves of data collection, and it's been repeated in numerous settings since. In this study, ACEs were defined with 10 categories: physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, violence against a mother, parental divorce, household member with substance use disorders, household member with mental health condition, and incarcerated household member. There were over 17,000 health maintenance organization members from Southern California that participated in this study. They received physical exams and confidential surveys. These surveys asked questions about their childhood experiences and their current health status, as well as behaviors that they engage in. In these questions, they were asked about these 10 different types of ACEs and if they had experienced them before the age of 18. When the study was completed, results revealed something startling. The greater the number of ACEs that you have, the higher the likelihood that a person could develop many different types of health issues, such as cancer, depression, diabetes, alcoholism, smoking, heart disease, autoimmune disease, stroke, and substance use disorders in adulthood. This study is when we started to understand that early trauma not only affects your mental health, but it also can cause your biology to change. ACEs and their impact on various aspects of an individual's overall health initiated a public health response to address this problem. ACEs are potentially traumatic events that occur in a child's life before the age of 18. This includes specific types of trauma, such as physical, sexual, and emotional abuse, neglect, losing a parent, such as through divorce, being exposed to domestic violence, having a parent with mental illness, having a member of the household who abuses drugs or alcohol, and having a parent who has been in jail. Children living through these experiences may suffer from adverse effects for the rest of their lives. Without a healthy adult to support them, they may experience toxic stress. They may encounter chronic health conditions like depression, asthma, or diabetes. If a child experiences chronic stress, it can lead them to have a lower tolerance for stressful situations in adulthood. Children can also experience PTSD and other mental health issues. So here's an idea of some questions asked on a typical ACEs questionnaire. I'll read a few of them to give you a better idea. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, humiliate you, or act in a way that made you afraid you might be physically hurt? The options for answers on all of these questions are yes or no. Did a parent or other adult in the household often or very often push, grab, slap, or throw something at you? Ever hit you so hard that you had marks or were injured? Was a biological parent ever lost to you through divorce, abandonment, or any other reason? Did a household member go to prison? Questions such as this. It's important to remember that your ACE score is a guideline. There may be other types of toxic stress that occur in one's life. This can also hurt a person's health. When you answer questions in this quiz, you receive 1 point for each question that you respond to with a yes. Each of these questions addresses the 10 different types of trauma. An estimated 62% of adults reported that they had experienced one ACE during childhood, and nearly 1/4 reported that they had experienced 3 or more. When your ACE score increases, so does the risk of associated health conditions as a result. However, it's important to remember that we can always improve our physical and mental health. If you find that you have a high ACE score, you may consider consulting a therapist or making lifestyle changes. It's never too late to have a positive impact on your overall well-being. About 1 in 6 adults reported having 4 or more ACEs. What type of impact is seen from this? Well, ACEs can be costly. The economic and social cost to families, communities, and society totals hundreds of billions of dollars each year. A 10% reduction in ACEs in North America could equate to an annual savings of $56 million. Preventing ACEs could potentially reduce many health conditions. For example, by preventing ACEs, up to 1.9 million heart disease cases and 21 million depression cases could have been potentially avoided. A further look into the impact of ACEs on children revealed that children who experienced 2 or more categories of ACEs are nearly 3 times more likely to repeat a grade, at a 40% increase for autoimmune diseases, 5 times more likely to have emotional, behavioral, developmental concerns such as ADHD, anxiety, or depression. Children who experience 4 or more ACEs are 7 times more likely to self-identify as alcoholics, 4 times more likely to develop lung disease, 4.5 times more likely to have depression and Alzheimer's, and 12 times more likely to attempt suicide. Children who experience 6 or more ACEs have a shortened lifespan by 20 years. Girls are 50% more likely than boys to have experienced 5 or more ACEs. When tackling ACEs and prevention, we utilize the list of strategies that the CDC lists for aiding in reducing ACEs. So here we have a chart that covers all of this. These strategies include strengthening economic supports to families, promoting social norms that protect against violence and adversity, ensuring a strong start for children, teaching skills, connecting youth to caring adults and activities, and intervening to lessen immediate and long-term harms. One of the listed strategies for preventing ACEs, as discussed, is intervening to lessen harms and prevent future risk. Children and youth with ACE exposures may show signs of behavioral and mental health challenges. They may be struggling with school, their peers, and they may already be engaging in other health compromising behaviors. An approach that can help to lessen the long-term harms of ACE exposure can consist of primary care. Preventing ACEs is not a singular effort. It takes a village. Although public health can be a lead, they cannot be the only sector that is contributing. Other sectors vital to preventing ACEs include, but are not limited to, education, government, whether it being local, state, or federal, social services, health services, business and labor, public safety, justice, housing, and media. Other organizations that comprise civil society, such as faith-based organizations, youth-serving organizations, domestic violence and sexual assault coalitions. In conclusion, ACEs are a serious public health problem with far-reaching consequences across the lifespan. However, they are also preventable. To maximize impact, these strategies and approaches discussed today are intended to be used in combination as part of a comprehensive effort to help ensure that all children have safe, stable, nurturing relationships and environments in which to thrive and achieve lifelong health and success. The hope is that multiple sectors such as public health, healthcare, education, public safety, justice, social services, and businesses will use this information as a guide and join in efforts to prevent ACEs. And that is it for today's program.
Thank you. We appreciate you joining us today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has also been added to the chat for your convenience. A special thank you to you, Ashley, for dedicating your time and expertise today. If you have any additional questions, you can send us an email at communityhealth@atlantichealth.org or give us a call at 1-844-472-8499. This concludes our webinar, and thank you, everyone.
Thank you. Have a great day.